Singapore will consider factors other than the vaccination rate when deciding to open up the country further. Senior Minister of State for Health, Dr. Janil Puthucheary, says that these include case numbers, the transmission trajectory, and status of testing regimes. Social behaviour in complying to safe management measures is also a consideration. Singapore saw an exponential rise in infections since the 23rd of August. It's led the authorities to put the brakes on the country's COVID-19 transition plan. But Dr. Puthucheary says that it's unlike previous waves of COVID-19, when the circuit breaker and heightened alert measures were implemented.
We implemented the circuit breaker and heightened alert measures, which significantly suppressed the rise of infections. The measures worked. But they were painful. They were painful to families, to workers and businesses. It's also not a sustainable way to battle the virus for the long term. We will need to open up social and economic activities, otherwise many people and businesses will suffer and we risk permanently damaging our ability to earn a living. But we have to do so safely, which means reducing the number of people falling very sick to a minimum. And for this, vaccination continues to be key.
The Health Ministry is also studying a rollout of COVID-19 booster shots to more segments of the population. Only vulnerable seniors above 60 years old and immunocompromised individuals can receive booster shots after their second dose.
The Expert Committee on COVID-19 Vaccination, the EC19V, will continue to observe global and local data, particularly on the risk of adverse reactions, before recommending additional population groups for booster vaccines.
He adds that the government will continue to study the process of granting full approval to the current COVID-19 vaccines, as well as whether to make vaccinations compulsory.
For full approval to be granted for any of the vaccines, not only do we need the data, but we also need the application from the manufacturer. So we're not in a position at this point in time to be able to answer that. As to making the vaccine compulsory, well, I think firstly we do need to wait for that process to if it happens at all. We also need to then look at our context. Our vaccine rates are much higher. The acceptance by our population of vaccinations has also been very different. Well, we will look at the matter, but I think at the moment there is no full approval anytime soon.